All right. Good morning, everyone. I'd like to thank everybody for taking the time out of their busy schedules to join us this morning. I think we've got a lot of great information for you to share. My name is Micah Matthews. I am one of the marketing directors here at Messer Financial Group, and I am pleased to also introduce Philip Mishler. He is the sales manager for National General. He is joining us this morning, and quite frankly, in my opinion, one of the biggest things that reasons that National General separates themselves from the other carriers. So very excited to have him with us as well. We're going to go over a lot of the product details. We're going to give you everything you need to know. Guys, again, I know I've said this before, and if you've ever listened to one of our webinars, short-term medical, in my opinion, is one of the biggest opportunities for those that are working the under 65 market. There's a lot of things going on around the market where, January 1st are eliminating the penalty for not having ACA compliant health plans, and they've also eliminated the 90-day rule on short-term medical plans, so we can write it all year round, and they can do next day effective dates. So if your client is relatively healthy and qualified to little to no subsidies, this is going to be the perfect way to save them some money and also build that value. So, before we begin, I do want to show you guys some things just to make it easy for you. What you're seeing on our screen is our home page. This is messerfinancial.com. This is where you can basically find anything that you would need for almost any health product that you sell. So the first thing for this purpose is we want to compare exactly what kind of savings that you're going to be able to provide for your clients who are currently on ACA plans. As we know, the penalty is being removed, so that means that a lot of the incentive to keep plans if you're relatively healthy and qualified to little to no subsidies has been removed. So there's a good chance that there's a lot of disenrollments. Just to throw a figure out there for you, there are currently in the country 7 million people that are enrolled into an Affordable Care Act plan that do not qualify for a subsidy. That's just people that do not qualify for any subsidy. So when I heard that number, I was kind of floored a little bit, because that seems like an awful lot of people that are relatively healthy that are going to be basically overpaying for their health insurance. I've given this example before. I had a family of 4, a husband, a wife, and 2 children, and they're paying $23,000 a year in premium. So you have to ask yourself, what are you protecting your family from? Because for me, I'm trying to protect my family from $23,000 in claims, nevertheless pay that in premium, and then on top of that have a deductible. So we know that the premiums are high. We know that there's going to be a lot of people looking to disenroll this year, and we just need something for them to fall back on. So first things first, to quote the ACA plans, we have a quoting tool. So again, this is our website, our homepage, messerfinancial.com. Under Agent Resources, which is right here, at the very bottom, you'll see a tab that says Quote Tools. When you click Quote Tools, it's going to give you a quote tool for just about every kind of product that you could possibly need, as well as forms and things like that. But for this purpose, what we'd like to discuss is the health quote. This is where you can quote the ACA. For those of you that are familiar or even not familiar with this, this is called the INSX Cloud. That's the one that we use. And I'll show you just how easy this is. So this is the Messer quoting tool. You do not need a login or anything for it. This is completely free for any agent that wants to use it. However, this is to use as quoting. Now, to enroll, you would need to have access to it in a login. But for quoting purposes, this is the perfect thing to use. So just to show you how easy it is to use, I'll show you a zip code. We'll just put in our zip code here in North Carolina, 28227. And that's going to be Mecklenburg County. We choose the effective date. We'll just say 11/1 for this purpose. Don't need to put in any of the client's information to quote. Male or female, so we'll just say a male. Doesn't matter what the date of birth. We'll say 1/1/1980. And then we'll hit next. Then it's going to ask you if you want to do these ancillary products as well, or just medical. For this purpose, again, we're just going to do medical. And we're going to assume that this person does not qualify for a subsidy. If you think that they might, you can always check by putting in yes. But for this purpose, we're going to put in no. And here you go. So it's always going to list plans by lowest premium to highest. As you can see, the first plan for somebody that was born in 1980, that's a 38-year-old. I want you guys to look at this premium, $479.07. So at the very end of this webinar, we're going to do a live comparison to show you the difference in the rates between this plan and a National General short-term plan, and how you can save your client thousands of dollars a year while also giving them a much better plan. So just keep this premium in mind, but I just wanted to basically show you before I hand it over to Philip Mishler how to quote an ACA plan, because you're going to need to show your clients just how much you can save them. So with that said, I'm going to go ahead and turn this over to Philip Mishler with National General. He's going to go over some of the products, and like I said at the very end, we're going to do a full demo, and also we're going to answer all questions at the very end as well. So with that, Philip, I hand it over to you, sir, and we can see your screen.
All right. Okay, great. Micah, thank you very much. Your quoting tool is pretty slick. Thank all the agents on the phone. I know it's a busy time. I'm not even sure how you folks carved time out to be on the call today, but I appreciate you being here. I'm going to put this in your world in an agent's perspective, and hopefully this will all make sense to you folks, and you'll be liking what you see. So this is my information. I am the Regional Sales Director for National General. I'm responsible to support Messer's business through our company, and also here to support all of your marketing efforts. So our primary product is short-term medical. And we have two types. We have what we call a standard short-term medical, and then we are the only quality carrier that has a guarantee issue short-term medical. So I'll share a little bit of that with you. In most states, we're offering 364-day coverage. There are some exceptions where we'll be offering multiple 3-month policies, 2 6-month policies, or in the example of South Carolina, we had to revert back to what we were selling before they imposed a 90-day limit. So in South Carolina, it's going to be 11 months. Okay. This is a grid of our plans. Most of our plans are $1 million maximum, with the exception if you folks choose 50%, you would be at a $250,000 maximum. So if you don't like $250,000 maximum, don't quote 50%. Our deductibles range from $1,000 to $25,000. What I like here, though, is we still offer, one of the few companies that still offers deductible and 100%. We also offer a $5,000 deductible and 100%. So one of the benefits is you don't have to explain what co-insurance is to your customer. You pay $5,000, you're done. So hopefully this looks good to you folks. All right, here's an overview of the guarantee issue product. So the guarantee issue is the exact same policy limits of our standard issue. The only difference is with the guarantee issue, we do chop the maximum down to $100,000. So if you look at it this way, if your out of pocket's $10,000 and your maximum benefit's $100,000, you're basically getting $90,000 of coverage, which may or may not sound good to you, but I can promise you it's 100% better than no insurance. Especially if you can't qualify for a standard issue. Maybe you have diabetes, you're not subsidy eligible, and you're wrestling with the cost of the plan. We do have this available. If your customer breathes air and they have a credit card, they can have this plan. All right, so a couple things to point out. Our plan allows the customer to use any doctor, any hospital in America. If they choose to use the Aetna network, their dollar is going to go a lot further because of the network discount. In my opinion, this is the strongest network we have in this country. This is richer than some of the household name brands that you've heard of. You will have trouble in most places not finding exactly who you're looking for. Let me rephrase that. You're going to have trouble. This network is so comprehensive, I don't think you're going to have any trouble locating doctors and hospitals. But again, we don't force use of the network. Okay, so here are a couple benefits. One of our first dollar benefits, actually our only first dollar benefit, is we do offer a $50 unlimited urgent care copay. And it doesn't matter whether you use a network provider with Aetna or you use any urgent care, it's all $50. Now, the $50 is to walk in the door, get diagnosed. So for example, if you go with the flu, they go, hey, you got the flu, here's a prescription, and you walk out the door, that's $50. But if they're doing x-rays, lab work, CAT scan, MRI at that urgent care, those charges, as you see here, go towards the co-insurance. So little known fact, if you're comfortable promoting 100% plans, maybe you have a customer, they're really jacked up on going to the urgent care. You hear them say, hey, I take my kid there every other week. You may want to consider promoting a 100% plan. And in that case, when they walk in that door, whatever they get done in urgent care, covered at 100%. These two aren't really like benefits. They're more like a penalty. I'm sure you can read there. Okay. So in order to get our plan, we do force the customer to join our life association. It comes with a whole bunch of benefits, but really the only ones that are worth talking about is this is where the customer gets their telemedicine benefit. Telemedicine benefit is free to use. And it also comes with a discount card for outpatient prescriptions. So here's exactly how prescriptions work under our plan. If the drug is administered in the hospital, it's covered under the medical plan. So if you need chemotherapeutic drugs, that's all going to be covered subject to your deductible and your co-insurance. On the outpatient basis, we give you this discount card. We give the customer a discount card to fill prescriptions on an outpatient basis. That card does not give a discount for pre-existing conditions. So it's important to point out right now, so we have a major competitor who has a $3,000 limit on prescriptions. So if you're not familiar with the cost of chemotherapeutic drugs, $3,000 is going to get you about 5 minutes. And that major competitor also has a 2-year look back on pre-existing conditions. Ours is 12 months. And one last item on the major competitor, they do not cover sickness in the first 6 days, and we do. So I'm going to move on here. Okay, it does come with some other benefits. Like I said, I just focus on these two because I know these are strong and they work. Okay, short-term medical available in all of the gray and blue states. So there's very few states we cannot write short-term. You'll see them here in white. These are our 12-month states. Well, we say 12 months, but it's really 364 days. So I'll let this up for a minute. You can see what we have in these states. And then here's where we have some unusual other terms. So South Carolina, like I said, 11 months. These states are 6-month states where we can string 2 of these 6-month policies together, and they're actually true 6-month policies. So in these states, these folks would actually be getting 365 days of coverage. And if you're unlucky enough to be in these 2 states, then you're subjected to this limit here. The eligibility ages. We're one of the very few companies that'll do child-only policies. So if you have a child-only, they're over 60 days old, you have multiple children, we'll take them. Just like the ACA, they're on our plan to age 26. And you see here if you ever need multiple children, maybe try and remember, you're going to quote the youngest one as primary. These are what our health questions look like. I'll leave these up for a few seconds. These are pretty standard across the industry, but this is what they look like. So answering yes to these questions makes you ineligible for the standard issue short term. And then this is the big question. Again, very standard in our business, going to knock out cancer, diabetic, stroke, heart disease. All right, just a couple more words on guarantee issue product. If they check yes, like I said before, they'd only be eligible for our guarantee issue plan. The good news is that the guarantee issue plans follow the same policy term lengths as the standard issue short term. I think this is probably the most important part of the presentation. This is the year where people who have finally been looking for relief, who aren't going to the doctor every 5 minutes, are going to get a break. Most people, and I'm going to show you this example at the end here. In my example, this person's saving over $4,000. But the key in annual savings compared to an ACA plan, but the key is suitability. These people have to know what they're getting themselves into. Okay, so the standard ones that you're probably used to telling customers is short-term medical does not cover pre-existing conditions. It doesn't cover maternity. It doesn't cover, here's a strange exclusion. Our plan will not cover joint replacement. So bones, tendons, joints, ligaments, we're not covering it if you wear it out. We're only going to cover it if you are injured and the injury requires this replacement. So it's super important. You got to let people know, hey, if you wear something out, company's not covering it. So my suggestion, I'm going to send this to Mike at the end of the call, is, and this is just my personal suggestion to you. People really need to know what they're getting themselves into. What I would suggest is that you print out from our certificate the couple of pages of limitations and exclusions. And even if you're in a quoting situation, send the customer the exclusions. Most people, the average person, isn't going to read our certificate in its entirety, but those exclusions, you know, if you put the right person in short term, you're going to be a hero. If you put the wrong person in, you're going to be a zero. So we can help you. I don't want to lament on this, but suitability is super important. Okay, so we do have some other products. I am not going through, don't want you to worry, I'm not going through all these products, but we do have some fantastic supplements. Most of these that you're seeing here are guarantee issue. You breathe air, you're getting it. And these are a good accompaniment to our short term, but all of these products are available standalone. We'll even do these on a group list bill basis. So let's say you have a small group and they have a large deductible. Let's face it, that's every group. And they want some cash if they get sick and go in the hospital. This is a guarantee issue product. You get 2 or more, we'll group list bill it to the group, and they can buy these individual supplements and not have to dig in their pocket for certain conditions and not have to satisfy their deductible. At least they'll have money to satisfy it. All right, and also have dental insurance. So this is germane to short term. So there's only 2 ways to pay, EFT or credit card. As Micah mentioned earlier, we do offer next day effective dates with one caveat. If you want the next day effective date, you have to put the application in today. The customer has to complete their 2-minute verification the same day. Because if they don't get the verification done on a case you would submit today, for tomorrow's the effective date, we won't issue their effective date till they do their verification, which takes a total of 2 minutes. And at the end of the 2 minutes, they get a temporary ID card. We do fulfill with a hard card, but during open enrollment, it can take a little longer. So there are some states that have specific limits on rewrites. I have part of the list here. So if you're in one of these states, you know, just be aware of what the limits are. If you're not sure, check with Messer or give me a holler. Once they do their verification, they go to this website, they print out a temporary ID, so they'll have proof of coverage a minute after they do their verification. Okay, getting back to suitability. Well, let's take a look at this. The other thing that's important is, as you're thinking about this and you're thinking about your book of business and you're like, okay, you know, I've got 500 individual customers. I think 10% of them are going to be a good fit for that. That's 50 people. Those 50 people need to know this information, and it's important that you share it with them. Okay, I'm going to run through a couple of supplements here. I'm going to move pretty quick. I think they have high value, and so here's what they look like. So the first one is that hospital expense protection plan. It is guarantee issue, and it can give your customer up to $3 grand once a year if they get sick and they're hospitalized. These are the benefit levels. I always like to start at the richest plan. So if you bought level 5 and you were unlucky enough to get sick and go in the hospital, National General is going to give $3,000 to your customer plus $150 a day for the first 31 days. And if you bought level 5 option, we'd actually give your customer $75 twice a year for office visits, $50 twice a year for labs, $50 twice a year for x-rays. If you didn't want these extra visits, you could just take level 2, okay? Or you could take level 1, save a little premium, but still have cash if your customer gets sick, goes in the hospital. I think you folks get this. This is guarantee issue. Oh, and one more point. The rates for this product, and I'll show you what they are, they never change. We reserve the right to change them. We never have. So when you think about products and a product relationship you have with one of your customers, imagine having a product that doesn't have rate increases. Right? I don't know. It sounds good to me. All right. Triomed. I love this product so much. I own it myself. What you're buying here is accident, critical illness, and AD&D. So this is what's important to know. Guarantee issue, accident, medical, critical illness, ADD. This is what you can get. The customer can get $2,500, $5,000, or $10,000 per accident, less a $250 deductible. And they get that equal amount if, God forbid, they become critically ill. What's cool about the critical illness is we'll pay out 3 times. So if your customer buys this, they get a stroke, they bought a $5,000 benefit, we give them $5,000. The next week they get invasive cancer, we give them $5,000 again. And then, as you could imagine, in the 3rd week of the most unluckiest month ever, if your customer gets a coma, they're going to get another $5,000 from National General. So you can get 3 payouts on this. The way we make a guarantee issue is we only pay out on initial diagnosis. So you come to us with cancer, we're not covering your cancer, but we'll cover these other items that you see here, these 15 major conditions. This is where Triomed's available, just about everywhere, unless you're in South Dakota and some of these outlying states. Cool. Eligibility age for the Triomed is 18 to 64, guaranteed renewable to age 70, just like our short term, just like an ACA plan. The children can be on the parent's plan to age 26. So let's get out of this for a second. We'll go over here. Okay, so I have captured this quote. This is an ACA quote for a male age 38. So when I look at this screen, the first thing that jumps out at me is A, this is the lowest cost plan in this area in North Carolina. But what's odd here is, in addition to having a $6,650 out of pocket, now, of course, as you know, that's this year's out of pocket. Next year's out of pocket is going to go up. But what's this here? Limited network. I don't know. Well, I wouldn't get that excited about a limited network, and I sure wouldn't be excited about paying $479 if I'm a 38-year-old male. That sounds crazy. All right, so let's run a comparison here. Let's see how much money this person could save. Okay, so if you're not already appointed, when you get appointed, you're going to get this quoting tool. This is run on the Quote-It platform. We did purchase Quote-It a couple years ago, and I think that this, other than the fact that the screen's moving back and forth, I don't know if you folks can see that. It's kind of strange. All right, so we're going to put this same male, 38 years old, on our platform. So as you see down here, the system's set to give you your effective date to tomorrow. If you don't want tomorrow, make sure you change this. Today, you can quote all the way out to January 1st. It's important to note that our rates do not change whether you're electing 12 months, 1 month, 3 months. These are all the same rates. And again, our deductible, actually, I didn't say it before, our deductible is per policy period. It is not per condition, or, it's not per incident on the short-term medical. The only way to pay for the short-term medical is monthly. You will see this single pay option. The single pay option is only for policies lasting 89 days or less. But this is a really good point in the conversation to point out, if you weren't already aware, it's super important to sync up your effective date with the first of the year. You don't want to rush forward and put somebody in this today for 12 months because it's going to run out shy of next year's open enrollment. And let's go through the scenario. Your unlucky customer actually winds up wearing out their hip during this period. And then we get to next October 24th, let's say it ran, 364 days. They've got a ways to go to limp on that hip to get to open enrollment to buy an ACA plan where they would have much more appropriate coverage. So super important to sync your effective date up with the end of the year. I think you folks understand. Okay. If you're an agent who likes to go out with the same type of package, like I was telling you about the 5,000 100% plan, if you click customize, you can create a package that you could give every customer. But if you don't want that, we're just clicking see all plans. It's going to pull up here my beloved 5,000 deductible 100% plan. All right. So this person's monthly premium is going to be $122. Let's go back to the ACA plan. $479. I've already done the math for you people. It's $4,300 worth of savings that this nice customer gets to keep in their pocket and not give it to Blue Cross. Trust me, Blue Cross doesn't need this person's $4,300. But think about this. Take a step back and think about it. If I save $4,300, I've got most of my $5,000 deductible covered under this plan. But let's say I don't even want to part with my $4,300. I come over here, I'm going to add some protection if this person gets sick and goes in the hospital. We'll do level 2. Let's say this person doesn't need benefits for doctors and hospitals. Okay, we'll put that in. And then I'm going to add another product I didn't talk to you people about. I'll make it short and sweet. This is straight up accident. These rates are pretty cheap. I mean, look at this. I can gap my plan with an accident benefit of 5. AME stands for accident medical expense. I can get $5,000 per accident from National General for $17 a month. But I'm going to do better than that. I'm going to go down here on this plan. You can buy accident medical expense plus cancer, heart, and stroke. So I'm going to add that. All right, I'm done making my package. Let's take a look at this. Now this person's at reoccurring premium of $181 a month. I'm way under half of what the ACA plan was. So I think you folks get it. Okay. And then if you were going to do a group list bill, now we'll do group list bill on every product we have except for short term. But if you pretended what's in this cart is just these 2 supplements, you'd click here and it would become a group list bill. There's one more step to it. The employer does have to fill out a piece of paper in advance saying who they are, where they are, and how they want to pay. The only way we do group list bill is automatic withdrawal from the employer's account. So there is like a 2-page setup document. Once we get it and assign a group list bill number, you click this thing, you're doing group list bill. You're helping your group customers not have to dig into their pocket to pay their deductible. So, Micah, are there any questions? I kind of moved pretty quick today. I want to make sure everybody's comfortable.
Yeah, there's a few questions here. One was guaranteed issue exclude pre-existing conditions.
Right, you can't have everything. So on the guarantee issue short term, we'll use diabetes as an example. I hope I'm answering the question correctly. You can, if you're diabetic, you can get guarantee issue short term, but we are not going to cover pre-existing conditions just like the standard issue short term. So then you would say to yourself, well, why would I want that? Well, you'll want that because it's going to cover you for everything else that comes up that's a covered charge.
Another question is it 364-day coverage? What is the term on that guaranteed issue?
Same as the standard. So if you're in North Carolina and most other states, you get 364 days, whether it's standard or the guarantee issue.
Gotcha. You had mentioned the 2-minute verification. Is that online or by phone?
So here's exactly how that process works. Once you click this button here, enroll now, it's about 5 minutes of typing. At the end, you're going to click submit. When you click submit, the customer's going to get an email. When they get that email, they open it, they click on a link, and that link draws them directly into the verification. When they're finished the verification, the agent's going to get, you're going to get paid because we ain't going to pay you until they do the verification because the policy will never go active. Agent's going to get paid, customer's going to appear in the back office, and the agent's going to get an email. So it's a pretty slick process. It's done online to answer your question directly.
Nice. Okay. Rebecca, are you there? Could you switch it back from Phil's screen to my screen because I want to show one more thing.
Thank you, Micah.
Thank you, Phil. So remember, guys, this is our quoting tool, and I wanted to show you something that's very important on this that's going to make your life that much easier. So when we went back to messerfinancial.com and we put up the quote tools and we pull up the health quotes, there's one thing that everybody needs to see is, and we're going to use the same client that we used earlier, one of the other options with the medical is, guess what? Short-term medical. So if I add this, now watch what happens. Very first one that pops up, National General. You've got
Say
the plan.
What? That's great.
Yeah, we've got you on our INSX cloud software. So now you can look up the plan benefits, the details, everything. So again, guys, this is going to make it very easy for you to quote this and enroll. So again, coverage length 364 days, one-time fee $35. All the details are broken out for you. If you want more details, hit plan benefits. You've got the brochure, the disclaimers. If you want to look up let's see, the summary of benefits, here you go. So, and you can filter it. Let's see. So, if you want
I should have just used your system instead of mine, and I can't believe we're offering a policy for $49.
For a $25,000 deductible, yes, absolutely.
Mm-hmm.
So
you got a low budget. That's a low number.
It's a very low number. So again, guys, what's so great about these plans, and as you can see, for a $5,000 100% plan, you are over 25%. I'm sorry, less than 25% of the ACA premium. So that premium for that 38-year-old on an ACA plan was over $400, and this one's just over $100. You could add whatever ancillary products you want to it and still be cheaper than the ACA plan. So if you've got a client that's used to paying high premiums and for terrible coverage, you're going to be a lifesaver when they meet you, because you're going to be able to offer them better coverage at a lower rate. And think about that book of business that you guys are going to be accumulating. You're getting healthy people that have money because they didn't qualify for large subsidies. What can you do with healthy people with a lot of money? I mean, think about it, guys. You're growing a book of business that is going to be with you forever. They obviously see the value in everything that you're doing because you're saving them tons of money for better plans. So now you've built that relationship to where they're going to feel more confident in other products for you. So for you life guys out there, what better way to get into a person with money's door than to offer something where you can save them hundreds on their health insurance? What can I do with all that money that I just saved you on health insurance? Look, we can do these ancillary products. We can do life insurance. We can do whatever you need because you qualify for everything. So the bottom line is, if you're not taking advantage of this, you're really going to miss the boat, because we've got opportunities in this business. When there's an opportunity to save your clients money and for us to be rewarded financially as well, I don't think that's something that you can pass up. There were a few more questions here, Phil. Let me just go ahead and over these with you real quick.
Sure.
Let's see. I'm sorry, bear with me 1 second. It says colonoscopy was a negotiated rate, but the reading of that procedure was not covered. Is it now with the 119?
Yeah, so obviously that's somebody who's currently writing. So yes, so we have a current exclusion that nobody in the company likes, and certainly nobody on the outside likes. We cover diagnostic testing, but we do not cover interpretation of the results, which ironically, in most cases, costs as much as the test did, which is kind of strange. But anyhow, we don't cover that, and it's in our exclusions. We have a product refresh / refiling. We're basically going to have a new short-term plan after open enrollment, sometime next quarter. But that will not affect anybody who's buying, before the first quarter, all right? Because you're locked in for 364 days with whatever you buy. When we do that product refresh, they have promised me they're going to remove that exclusion. It's basically, nobody knows how it got there, but it's there, and we will be removing that. So there's better days ahead, but for right now, that is the case.
Phil, I am sorry to say also that as easy as your enrollment platform is for National General, ours is actually easier because it's...
I'm not going to argue with you. I'm just going to say it's a fantastic quote engine. It makes it easy for your agents. And, we didn't talk about commissions, and I'm not going to be stating commissions on this call. There's a lot of money in this. So if you have customers who are in pain over the cost, and you can separate the people who are going to the doctor every 5 minutes from the people who make statements to you like, hey, I hardly ever use this, or I never use it. If that's your red flag, and that is a person that you can step on the gas pedal and really help, as long as you're fully disclosing to them so they know what they're getting themselves into. It's a win for them. It's a win for you. And they're going to have all that extra money that they can use in their own budget. They could buy, in this example, this person could buy every product we have and still be under the ACA rate. So it's a tremendous opportunity. I hope that you will lean on Messer and myself if you have suitability questions or anything that you need to see or hear to be comfortable with this.
Phil, just a few more questions. Does National General notify the agent of record when the customer's plan is coming up for renewal?
Yes, and we also have a rewrite team that will reach out to your customer and attempt to rewrite it in your name. But you got to really don't trust anybody. So if I was the agent, I'd look for the email, but I would definitely, you don't want to miss one of these rewrites. So I'm not sure. I'd wait for an insurance company to call my customer. You have a back office. You can see when these policies are expiring, and and yes, we will send a notice, but you want to stay up on that rewrite and not have somebody have a gap in coverage.
Are these plans guaranteed renewable up to 36 months? As in, they don't have to. They only have to be written as if, and they don't need to be underwritten every year.
I wish they were. We had looked at doing that, and pricing was it was too hard. I mean, you're asking us to give you a price today for 2 years from now. It wasn't doable. So these are rewritable in most states, unlimited amount of times, but you will be touching it once a year. But let's face it, you're touching your ACA people once a year anyhow. In a lot of cases, they're making a plan change once a year. What's the difference?
That's right. Rebecca, I'm sorry. Can you put Phil's screen back up? Phil, they'd like to see your contact information again.
Okay. All right.
We're going to put just 1 second. You should get a share.
Yeah. Give me 1 sec here. Okay. Show my screen.
Yep. There you go. We can see it.
Here. Okay. Current slide. Okay. There you go. So if you want to come see me, this is where I'll be. Next 6 weeks, I'll be behind my desk right here at this address, or you could, a lot easier just to call me or email me.
How far in advance can you write a plan?
We're past January 1st now. It's 90 days. So you can go pretty far out.
Great. Well, like I said, everyone. Oh, and I'm sorry. One more question. Are they still give a office visit benefit of $50 in Florida? Do you know?
That is true. That is true. That's a state law. Someone just asked me that a couple of weeks back. So that is accurate. It's a state variation that wasn't part of my presentation here, but that is the law in which we have to operate under. So yes.
Perfect. Well, again, guys, I want to thank everyone for taking the time to spend with us today. I hope you were able to get some useful information. Like I said, Philip Mishler, use him. He's a great resource and unbelievable for me. He's honestly a game changer as far as who I've done business with. We all know that we want to do what's in the best interest of the client, but when you also have ease of doing business added with that, it just makes for a win-win. And again, you're saving your clients a lot of money, and that's always a value. So, Phil, is there anything that you want to say in closing?
No, just yes. There's a lot of folks in pain. Separate the ones that are the lower end users, and it's a win-win for everybody.
All right. Well, thank you, guys. All of our webinars are posted on our website at messerfinancial.com. This one will be posted on Tuesday. You're welcome to go in there and check out anything that we've done. And if you have any questions, feel free to contact Messer Financial, Philip Mishler, whoever you need. We will get you what you need to be successful. So again, thanks everyone for taking the time, and have a great week and good luck out there. Thank you.
Thanks, Micah. Thanks, everybody.